It's Reality Check with Craig Price.
I'm an idiot.
4 minutes in and I'm already wrong.
I'm like a monkey. Hello, look at me. Craig, shut up. Hey, I need you guys to do these things.
I'm Craig Price, professional bastard. Nice to meet you.
Welcome to another Reality Check with Craig Price. This week, Anastasia Turchetta returns for our annual dental health checkup. But before I get to Anastasia, I do want to thank everyone who's been listening. You know, the show continues to grow bit by bit, so I really want to thank you for listening. And for those that you've been sharing the podcast, you know, feel free to tell people about it. That doesn't hurt. You know, you can post individual episodes on your blogs if you've got them. You can share links on Facebook. You can like our Facebook page. You know, I've also set up a Twitter list. So if you go to twitter.com/realitycheckpod, you go to that site, you'll see a little thing on the sidebar that has lists, and you can join that list where you will see all the tweets from past guests. So not only do you listen to them on the podcast, but you'll get more information from them in perpetuity just from the Twitter feed. So I'm not going to lie to you, though. Some reviews on iTunes wouldn't hurt. I mean, preferably they'd be 5-star. And in fact, if you have something you dislike, give me a 5-star review and then unload in the comments section. So it's kind of a win-win. We both get what we want. I get the 5 stars. You get to tell me what's wrong. Everybody walks away happy. And of course, I'm always on the lookout for great guests. You know, I have my ways of getting guests, and I'll be honest with you, I've been getting some pretty weird solicitations from get-rich-quick people. So I would much rather hear suggestions from you. And I'm sure you would much rather have people you want to hear on the podcast. So let me know who they are. Email me at craig@speakercraigprice.com, and I will do my very best to get them on the show. But for now, sit back, breathe in the nitrous, count to 10, and enjoy this year's annual checkup with my favorite hygienist, Anastasia Turchetta.
You know, I wanted to come on because it's just like anybody who gets their teeth cleaned. You know, you should go twice a year, I'm assuming, 6 months, every 6 months. But, you know, like the rest of us, we go once a year. So our annual, it's been about a year since you've been on, Anastasia. And so I wanted to get my checkup and find out what's going on out there as far as oral health is concerned. And so what can you tell me about? I know one of the big things that you're warning everybody about is oral care and sleep apnea. Well, how do those two connect?
Well, you know, Craig, I want to thank you for having me back on here because a lot does happen in a year. And yes, everybody is generally, we recommend it twice a year. And the reason for that is because, you know, I mean, biofilm, we call it in dentistry, is biofilm. But
I've seen a couple of those. That's a special section in the video store. You got to go behind a curtain, don't you?
Yes, that it is. And you know, when you're looking at things like that at a microscopic level, we don't realize, or the public doesn't realize, that it's that nature that can cause significant damage in your health, let alone your bite and your smile. So, you know, things happen in a year. So again, I just appreciate you having me on here. Yeah, sleep apnea has really, I would say it's one of the newest trends in dentistry for us to start to identify for our patients. Because let's face it, it may be on a health history, but Craig, on average, there's a lot of people that still don't know what it is. They might say, well, my partner snores, or, you know, they have trouble, they may stop breathing, but they really don't realize it's a really serious condition, not just for adults, but also for kids. So for us to start to dig, no pun intended, further into the health history to try to get that patient to talk more about what they're experiencing is huge for sleep apnea. And
well, before we start, what is sleep apnea? Because I don't even know what it is. I mean, I know it has to do with snoring, and I know that you have to wear a contraption that makes you look like Bane from Batman, but but I don't know what it is or what I know it can be dangerous, but I don't know what it is. So tell us what sleep apnea is before we figure out how we can fix it.
Okay, sleep apnea it's when you have more pauses in breathing during your sleep pattern, or more like shallow breaths while you're trying to sleep. It's a chronic condition, so it's not going to happen just like on a fluke one night and then not happen again. So generally this will lead to people who are extremely tired during the daytime because their amount of quality sleep is interrupted from this pattern. And usually it's your airway that's collapsing, or generally if you're obese or overweight, it's the back of your throat, especially if you're laying on your back, you can't breathe. So then it interrupts it and you get into snoring, and people think it's a snoring problem when actually it's more, it's more serious than that. It's an airway problem. So there's different types of it, but the most common of it is obstructive sleep apnea.
And so is that like, when we talk about is that just the weight of your own throat weighing on your air passage?
It is. When you're looking at overweight individuals, the weight of the skin and the muscle, it's helping to collapse that airway that you're used to for breathing. Other individuals, it's, if it's left untreated, it goes right into your health, and that could be contributing to high blood pressure, heart attack, stroke. Kids can normally get it if they have enlarged tonsils. So again, you're looking at something that's pressing on that airway, and we're unable to breathe. Sometimes, too, it could be caused by a defect in, your sinus cavity. It could be a sinus infection, something like that. But it's really important to address this with your dentist, because if it is a dental problem, we can help you out. But also, sometimes you may be referred to a medical doctor, which will then take you to a sleep center. We just need to know why you're not sleeping and what is causing the interruptions of that sleep pattern.
Now, when you talk about sinus infections, how can that relate to the closing of the air passageways? Because, I can understand the physical. I actually think I've seen something online on late night television where they sell something that you put, it's like a mouthpiece that you put in that keeps your jaw from falling backwards.
Exactly.
But what's the sinus infection do?
You're obviously up at night watching this stuff.
Yeah, well, I don't sleep well, but I don't snore either. I don't have sleep apnea. I just have, I just can't sleep.
Hey, I'm with you. A lot of us have insomnia, but that's a different topic.
Yeah, that's
dentistry cannot help you with that.
That's not oral related. That's just mental, stupid, crazy for me.
Exactly. Although that just puts me in the same category. But, it's one of those things as far as the sinus infection. If you have a deviated sinus, or if you have a sinus infection or allergies, you were just sharing about your dog, what I find interesting is the fact that you're going to have that drainage. And if you're laying on your back, you've got enlarged tonsils, or you've got a lot of drainage going on. How big is your airway? So there are, in dentistry,
it's big enough. We don't need to get into that. It's average sized airway, at least, maybe slightly larger than average.
But not everybody. So one avenue to look at in dentistry is there is a device that we can use where we measure the patient's airway. So how big is it? How much air is passing through? In addition, it can measure your nasal cavity, because you take the combination of that and your air pathway, and it might provide us some answers. And that, may also warrant a visit to the sleep center, which, at least that too will say, okay, they need maybe a device, whether it be a mouthpiece or oxygen, because when you don't have oxygen delivered to the brain, that's not a good sign.
Well, that's definitely not a good sign. That usually is where they talk about people could die from that situation. But I've met a lot who just don't have it going to their head normally on a regular basis, regardless of apnea.
Well, it's important to definitely look at that, because you've got over 12 million Americans who have that, and to know some of the risks, I think it's important for us as dental professionals to ask, and then also look at it from a co-diagnostic perspective. Look into the sleep centers, and I'm sure people will ask, does dental insurance cover this? You work with your medical insurance because you're going to go to a sleep center. So I would encourage people to take that, a step further and team up with your dentist, your medical doctor, and see how we can help you getting back to healthy sleep.
Now, it helps if you're married or in a relationship where when you sleep at night, the other person is hitting you with the elbow to let you know you're snoring. But
hitting with the elbow is better than covering your face with a pillow. So yes.
Well, one doesn't lead to prison.
It could.
Yeah.
It could.
But if you're a single person, is there any signs that you may have sleep apnea? Because how would you know you're asleep?
That is true. It's a great point. I think it would be tougher to diagnose, so I would encourage, if you went to the dentist, is to start asking more questions, is the fact that, okay, are you sleepy? Do you suffer from insomnia? And insomnia, which is on most health history questions, then dig a little further. Okay, when do you experience it? Do you experience it during the day? Because if it's during the day, then I'd be like, they may need a little help here, because most of us should not be sleepy during the day if we're getting quality sleep.
Okay, well, that's not, so basically, if you're groggy all day, ask your dentist, ask your doctor, ask anybody who has any kind of medical background, because it's overlooked quite a bit.
Well, exactly. I mean, and, sometimes, too, people have headaches in the morning. They'll have problems with their memory, and it's just because they're really tired because they didn't sleep good. So, I mean, to go back with, if you're single, how would you know? And also look at your health history. Do you have high blood pressure? Are you overweight? Do you have diabetes? Does heart disease run in your family? And you might look into and go, wow, I'm tired in the morning. I've got these headaches. I'm unable to, concentrate and do my tasks at work. Irritable or depressed. What's going on? Do you have a dry throat when you wake up? I mean, those kind of things are things to look at in identifying whether or not you might have that.
Well, also one of the symptoms that you just brought up was headaches, and I know that you wanted to talk about the connection between migraines and oral health, and not just in a sleep apnea way, but in general, if you're having migraine headaches, which in my experience, I don't think I've had any real migraines. I mean, maybe years ago I've had a couple headaches that really bothered me, but they were like isolated incidents. So, I mean, what's the difference between a migraine headache and just a regular headache?
Well, a migraine headache is actually one that it can last for days. It can be debilitating. It literally affects the individual's life. So, I mean, most often there could be an aura. So some people can see almost like, I don't know, their eye, they'll say they see something in their eyes. They need to be in the dark. They don't want sound. Sound to them just like will send them over the edge. It can last for a couple of hours if you don't take care of it right away. It can last for a couple of days. A headache, a normal headache, if you will, generally your Advil, let's face it, Excedrin, something can help with that. And it doesn't last for days. It could last for a few hours, which is obviously annoying. But this isn't absolutely debilitating where if you were in sports and let's take the Olympics, this could affect somebody's performance to have a migraine and not have it dealt with.
So how does oral health come into play in this situation?
Well, first of all, we don't give headaches. Let's just get that out.
Sure.
I'm sure so many people are thinking, wow, my hygienist gives me a headache. But one of the things, again, is looking into our health histories, I find it so interesting that all the clues are there. We just need to ask more questions and ask good questions, because obviously the appointment time is limited. One of those questions is, probably 30% of Americans suffer with headaches, but they don't think that they're migraines. What we can do is really say, hey, have you had any trauma from, what was the last thing you can remember? Was it a car accident? Let's look at the Olympics. And the thing that sticks in my head was, I believe her name is Anastasia, when she fell at the preliminaries. I mean, she just fell flat onto her face, and I thought, oh my gosh, that has got to hurt. You look at, did you have any injuries like that? Any sports injuries? Anything like what if you went horseback riding, or do you have TMJ? Or
what's TMJ? Is that TMJ is the jaw thing?
Yes, TMJ is your temporomandibular joint. So
that's why you say
TMJ. It's what opens and closes your mouth. So they'll measure that too. So what we want, and there's a system, how like if you go to sports dentistry and how they'll use different techniques to get that joint moving again.
No, I'm not an athlete, so I don't know. I've never had to go to sports dentistry or sports therapy.
You never played sports ever.
I did, but we didn't. This is back in the 80s when I was in high school. We didn't have sports therapists. We had the nurse. We had ice
packs.
Yeah, rub dirt in it. That was. We didn't have all the high tech sports therapy jogging in water tank stuff. It was just you got hit in the head with a bat, shake it off, and go to first base.
You didn't have lawsuits.
Yeah, no, we didn't do all that stuff. No.
Well, I'm very impressed that you're not one of those people back in the 80s and saying, oh, it's an old sports-related injury.
I have both, but I just haven't gone to a sports therapist about it. It's just one of those things I got bad knees.
You have another therapist that you go to.
Yeah, then it costs about $150 an hour, and is not worth it.
Oh, man. Well, what we do is the one system that I've witnessed and seen work is called Trudenta, Trudenta, and it basically it's a treatment or a therapy system. It takes the idea of sports dentistry and biochemistry and working with the joints and loosening up scar tissue within, around that jaw joint and into the facial muscle area, because there's a lot of nerve endings that people have no idea are affected. So let's take it if you're ever stressed out, which none of us are, and you just keep clenching your teeth and you keep clenching your teeth. Over time, we do wear away some of that enamel. Or what if your bite is off? Or, again, I'm going to use the car accident example, or another, if you were in cheerleading or soccer or football, sometimes too your bite can just be off by a few millimeters. That's going to make a big difference in somebody's headaches. So what they do is they measure the full range of motion. So if you were to take your chin and tilt it up towards the ceiling and then down towards your chest, they measure that. Then going all the way to the right and all the way to the left.
I can go up and down, but when I go down, I get the turkey neck going, so I try not to do that too often.
Thanks for the visual.
I get the gobbler going, but... how far?
I'll think of you at Thanksgiving.
And I'm actually doing it, so I'm like, I have to actually look into the microphone because I was about to ask a question as my head was facing the ceiling.
I wonder how many people just actually did do that.
I just did. No, I was doing it. So I was going to say, how far back do you need to tilt your head before it's you're in the normal range?
It's actually measured it's per individual, and you're hooked up to their system. So, and it's also called a touch scan. So we're measuring, to the right, to the left, up and down, full range of motion. And we're also measuring how far can you open your mouth. So we were talking about the TMJ. So there's a certain amount of millimeters per person. Of course, it depends on, the individual and if they've had surgeries and stuff like that. But we want to make sure that if you can't open your mouth, sometimes that leads to headache. So the job with Trudenta is to restructure or basically rehabilitate the way your muscles are currently at. So, it's no different from sports dentistry, but this is actually affecting your headaches. And they have got a consistent, predictable method, and it could take from 5 treatments to 12 treatments. And it takes about an hour. It's amazing the results of people who come out of it. I literally witnessed somebody having a migraine that day and watched them, with the system. And in one treatment alone, she was able to at least function through the day where it was taken down to what you and I would label as a headache. And for her, that was huge.
Well, then I'm going to ask a really tough question that only gets asked here on Reality Check. Is, should you be able to put your fist in your mouth? Because that looks like it should. That's too much. Because I see that a lot of people. People think it's a big deal, and it's like, that's wrong. You shouldn't be doing that.
Taking it from someone who usually puts their foot in their mouth.
Well, I was going to say most of the time.
It's not such a bad option.
Yeah, most of the time when I open my mouth, I cause headaches. It's really weird. So.
And sometimes for me, those who hang with me, I could give them headaches. So, either way. No, putting your fist in your mouth is not something I would recommend that would be healthy, obviously. There is a limited, there's a motion of range, which Trudenta calls it the mandibular release. And what we're looking for is to get the maximum amount that your jaw joint will open without pain. And also have it, do that consistency. We're talking about people who have a hard time eating. I mean, can you imagine not being able to take a bite of even corn on the cob, an apple?
Well,
something like that.
At my current weight, I would be a dream. But no, that would be a nightmare. I can understand how that would be a difficult situation.
Yes. And then so also you've got some of these individuals who are looking at taking prescription medications. And I can't remember the last time, because I used to be on Imitrex. I used to get migraines also, but it was more stress related. So thankfully it wasn't bot related or injury related. But the other thing being is people are spending a lot of money on prescription medications per month just to try to get out of pain. You take that in combination with other health ailments, it depends. If they could get off of prescription medication for a headache, wouldn't that be wonderful? If they could return to a normal life where they wouldn't have to miss, let's say a family gathering, a sports event, something that was very special to them because they had a headache and live a normal life. To me, that's phenomenal. It's non-invasive. There was a surgery the other day I saw on TV. It was crazy. They put a neurological transmitter literally into the skull of a beauty editor. And I was really surprised when she chose that route, but it was just to get out of pain. People will go to all measures.
What does the transmitter do? Because that's sounding very conspiracy theorist.
It does. You should see it.
Like I need a tinfoil hat or something.
Yeah, I could totally send you the link. But, I mean, it's one of those things, as soon as the nerve receptors feel pain and they basically give a joint, or, a jolt, not a joint. That sounded great. It triggers this neurotransmitter, and then it almost intercepts the pain. So she will not receive, a headache or a migraine to the extent that she normally would.
Oh, so they attach that right to the nerve, so it kind of bypasses the end result. It just
exactly.
Wow.
Yeah. And then some other people are choosing to go another route to get out of pain, and that's by Botox, where they give the injection in the base of the skull. So in my, I always try to look for something. There's got to be another way that we can help these people get out of pain. So, it's likely your butt, because the forces that we have, your head weighs what? They said in Jerry Maguire, 8 pounds.
Mine weighs about 7.5, yeah. I like to keep a little extra room up there in case something comes along. Like the conversations like this, I'm learning, so maybe it's up to 8 3/4.
Hey, it's an exercise. There you go. We're rehabilitating. There's always room for growth. It's one of those things where I look at it and I'm like, okay, this is a great way. It's consistent and it's predictable. 95% of the individuals who are treated via this system are out of pain. They're off of prescription medications. They don't have to go through extreme measures of something that's invasive. And in dentistry, I think that's something we ought to at least look into, refer somebody to, and educate the public on.
So basically, the one thing that you definitely want people to know is that regardless of what kind of pain you might be having in the head area, talk to your dentist, because it may be something that they can help you with, even if you don't think it's mouth-related.
Exactly. A lot of people may think, well, it's because I grind my teeth, or it goes back to the TMJ joint, the temporomandibular joint, and some people think of that. When in reality, headaches can be linked to this, but there's a way that we can help you that's not invasive, it's healthy, and it's proven.
Now I know that you've been big on the social media. You've been tweeting away. You've also got your weekly video podcast, I would call it. It's a vlog, the Hump Day Happenings, which is an awesome name. Though I haven't figured out why it's called Hump Day when most people do it at the end of the week. But how can social media? How's social media been interacting with oral health lately? Because I know that I've seen you on there a lot, and I actually, quite frankly, I've met a lot of oral health speakers, which is kind of unusual because I'm not really dipping in that pool, so to speak. You're my connection. But apparently, in social media, there's a lot of things out there that you can use to be helpful.
Well, I was really surprised, and a lot of patients are starting to go to Facebook and Twitter to get some information on them. Either, well, hey, should I find a dentist? Can I go to, who would recommend a dentist? So I encourage anybody who's got, a dental practice, if you've got a fan page, to keep that active, not only just to say, okay, our practice is doing this, but also with what's happening in the news. Like you and I just addressed sleep apnea. So, I'd encourage a dental practice, okay, hey, start giving some facts on sleep apnea so your patients can read about it. And then, if they feel, hey, I think I've got some of these symptoms, they can come to you with it. In dental hygiene should have a presence on that fan page also. So we could say, okay, gum disease, this week we found this. It's related to rheumatoid arthritis. So save your knees and clean in between to make sure there's no gum disease.
Well,
something like that, make it fun and interactive. Social media has really come far, especially with videos too, because you're going to have people who would prefer to watch the dental team or something like that versus read a research article. Know your target on social media. You asked me for Hump Day Happen. It's important to know the tags and know your target. For me, I thought, hey, Anastasia's oral health tips, who's going to watch that? I wouldn't. Really.
A small collection of Japanese businessmen?
So you got to come up with something sassy. And then I thought, well, a lot of people have newsletters on Mondays, so that's out. And I thought, you know what, Wednesday, Hump Day, it could be fun. It's sassy. So why can't we make oral health fun and sassy in an environment in which everybody's welcome?
And one of the things you just brought up that I just heard, you were talking about how oral health and RA, rheumatoid arthritis is connected. How is that? I mean, I don't want to get off topic, but on social media, but that one, I know a lot of people who have RA.
But you are.
I know. I don't mean to, but I'm going to because when am I going to talk to you again about this? I know a lot of people who suffer from RA. My mother-in-law being one of them. My wife may potentially someday, because of its genetic, may have to do that. So how can oral health help with RA as well?
Well, what the research has found is there's a link. It doesn't mean it causes it. And that's the thing I think a lot of people will, it was kind of like with gum disease and heart disease, because they said that, well, gum disease doesn't cause it. Well, no, it doesn't cause it, but it's, a risk factor for it. So what they're finding in some individuals who have gum disease, which 80% of the population has at least one active site of gum disease. So they're finding there's a relation between the bacteria that's in your mouth and then, of course, around the joints, that are affected by RA. And I found that very interesting because it really is all connected. So it's kind of like how heart disease is linked to, doesn't cause it, but it's linked to diabetes, heart disease, and stroke. And we could go on and on with other ones, but they're just finding this year that rheumatoid arthritis is also linked to the same type of bacteria that causes gum disease.
Okay, because that's why it's the bacteria then that's kind of floating around.
Bacteria. Yep, so exactly.
Your gums are the doorway to your demise if you don't keep them clean. They just let everybody in. They're like a really bad bouncer at a club.
Well, it kind of is. I mean, look at how we were talking about putting your foot in your mouth. I mean, it's one of those, I don't think people realize because it doesn't hurt. And a lot of the public, 2 reasons. They may not have access to care now, of course, health insurance or low income, people losing their jobs. So it's kind of on the back burner, or they're not educated. Who is responsible for that? It could be your dental professional, but it's one of the reasons that inspired me to, let's educate the public. Let's get it out there. And social media is a great avenue to do that. I mean, I'll post anywhere over anything, as you've just noticed. Take, for example, The View. Look at that example for going viral. The View hosted Where the Jobs Are. And I found this so interesting in how Sherry Shepard, who is a spokesperson for Oral-B, so she should know better, but she said, let's talk about jobs that are hiring without a college degree, being a dental hygienist. Now, people listen to this. They went viral. I was so impressed with our profession.
Like bacteria in your mouth, they went viral.
They went viral. They did.
It went to the knees.
It was really cool to show social media, being the comments. There were videos sent in, different things like that to tell the View, look, you got your facts wrong, and you need to get them right. They issued 2 apologies. So social media does work in making sure the facts are right, but you've got to make sure, just because you've seen one episode of View doesn't mean it's accurate. So you kind of got to recheck.
Well, the fact that you're watching one episode of The View, probably you're getting a lot of inaccurate information on a regular basis. Because you're not really picky.
Political advice, I'm sure.
You're not really picky about where you're getting your information from in the first place. But I like
Dr. Oz for that matter, and I love Dr. Oz. But let's face it, it's about ratings, and they're going to give you what they can. That does not mean their information is accurate.
Well, and I always say that we have to be the journalists now, that we have to verify information that we hear. We can no longer look at the newspaper, which they don't exist, look online, watch the news, and hear somebody say something and assume that's true anymore. We used to be able to do that. It used to be pretty much a given that if you saw it on the news, 95% of the time it'd be accurate. And now it's not. You go, oh, really? And then you have to go verify on your own. And so, like Dr. Oz, all I know is that he talks about poop more than any other doctor on television. And he's not always correct. I mean, I have other friends. We have mutual friends, Liz Green, who's a heart attack survivor and knows all about heart health and has seen him make errors on that show. And so you want to verify everything you can.
Yeah, I mean, you take, I'm sure if he took, he did something, for radiology, and he put, saying about how there's so many x-rays out there, and you're right. I mean, you really need to look and say, okay, that's Dr. Oz, and I thank him for bringing, attention to the dental profession, but could you do it with the facts? Instead of scaring individuals, like you said, like about Liz, like he went on to say something, it was for whitening his teeth. And he's like, well, I do it. I sit in my on my couch at night, and I take a cotton swab, dip it into lemon juice, and baking soda, and I just rub it on my teeth as I'm watching TV.
That sounds bad.
Dr. Oz, you do not. And first of all, not everybody qualifies as a whitening patient. So it's kind of a blanket statement to put out there for people who are Oz followers, you know?
But that much citrus and acid on your teeth, that sounds like it'd be bad.
Exactly. You're taking an acidic, you know, the lemon juice being the acid, and then the abrasive with the baking soda, and you're trying to whiten teeth where, you know, if you have crown work or an implant or, you know, sensitive teeth, this is not the avenue to go about it. And I can promise you, Dr. Oz is not sitting on his couch doing this method of teeth whitening. I can promise you. So why would you share, you know, other things like that with individuals?
Well, before we let you go, we got one last thing that I know you want to talk about, because you speak all around the country on a lot of oral health care, but you really want to talk about how important one's smile is. Now, I have a crooked, awful smile that I can't stand. I always look confused.
Yeah, but you invested in your smile.
I didn't invest in my smile. I invested in my health. You're talking about the gum surgery I had last year.
I am, yes.
That was more of, we just talked about them being horrible bouncers and they're letting everything in, you know, bacteria and all these diseases through. That's how a lot of people get a lot of these diseases. It comes through the gums. I've invested not in my smile because really I'd rather tear down the building than, you know, reinforce it because it's cheaper that way. I'm just making sure I don't get any kind of weird, like you were talking about, making sure I don't get anything weird because my gums are bad and they're letting infection in and all that stuff. So that was more of a health investment, which I think you would appreciate more than a smile.
I do.
But you're talking about how a smile is important. I'm self-conscious about mine because it's like only on one side. When I smile, it's more of a smug smirk. So how important is a smile, and what can we do to make sure we have the best one or the proper smile?
Well, I believe that when you smile, you can't help to have somebody else smile back at you. And taking that and realizing how it affects your whole health, which is what you did, completely just puts the bow on top of the present. You know, I mean, but your smile is very powerful. And I just read an article today on how it boosts your immune system and lowers your stress when you actually smile genuinely. And there's 19 different types of smiles. So I find it very interesting how that relates to our work situation, whether somebody gets promoted, whether somebody, you know, we smile more at home, or we should. Actually, we should smile all day long. I smile all the time. So it, to me, doesn't matter if I'm at work or if I'm at home, but more people seem to smile at home, according to studies. And I find that interesting because if you're that unhappy at work, it may be possible for you to think about, okay, where can I be most productive and happy? Because it does affect your health. So, I mean, it's just very interesting to me of how important smiles are. And another thing to consider, you had said your smile was crooked, but you can have two options. There is Invisalign technology, which are invisible braces. So they're almost like little mouthpieces.
Well, my teeth are not crooked. My smile is crooked. I smile with one side of my face.
Teeth were.
No, my smile is on one side of my face. When I smile, let's say, hold on. Let me practice. Yeah.
Yes, I wish we all could see that.
No, believe me, you don't. The left side of my face is what smiles. The right side doesn't smile as much. It's just one of those things. I'm not a smiling person. I'm not I'm a happy person, but I'm not a smiler because, you know, I don't know why, but it's just one of those things because I guess I have that lopsided smile.
But you could still tell somebody if somebody's genuine or if they're not genuine. And I find that really interesting and how powerful it is can impact your relationships. I mean, women actually do smile more than men. I know that might come as a shock, except this is very interesting, in social situations or at work. Isn't that interesting? We'll smile about the same because some people, let's face it, they're not that comfortable in social environments, or some people aren't that happy at work. So I find that all of that, you take how it impacts your health, and let's face it, of course, it's how you smile or how it looks. This is very powerful in how you live your everyday life.
Well, I know every time I see you, I smile, and I know that you're a big smiler. So I really appreciate you taking time to get us up to date on a lot of different things. I can now sleep tonight and not feel bad. If I get any sleep, I will know it's not.
Yeah, let's hope you can sleep. So we should pay attention to that with sleep apnea, you know?
Well, I have a wife who would tell me if I'm snoring.
Gently nudge you.
Yeah, she would gently nudge me. She's more of the pillow over the head. But where can people find you?
People right now, because I'm redoing my website, people can find me on Facebook, Twitter, and LinkedIn.
Okay. And give them your Twitter account is Anastasia RDH.
RDH, Registered Dental Hygienist. And that's my YouTube channel, too, so I encourage you to check out a couple of videos.
And those come out every Wednesday.
Yes.
Well, I appreciate you spending time. I will see you again. We just saw each other a week ago. And unfortunately, we don't see each other enough. So when I do, I'll make sure I try to smile from both sides of my mouth.
And I'll be sure to tell you if it's genuine or not.
Well, then I will start practicing my fake smile. That's my homework. I am now going to fake my smile, so that's my goal for the next year, is to make sure the next time I see you, when I smile, it'll be so insincere, but you'll think it's genuine.
That is something that you can't make it, when you fake it. A smile, you just can't fake it.
That's our show for this week. Thanks to Anastasia for joining me. I feel like I should floss or I'll never sleep again, but head over to realitycheckpodcast.com to sign up for the monthly newsletter or subscribe to the YouTube channel. That's right, all our podcasts are available there as well at youtube.com/realitycheckpodcast. See you next week.